Heather. I'm going to talk about the cystic fibrosis sinusitis. I was supposed to do some videos for like 2 weeks, but I'm sorry. It was my birthday, and then I was having a lot of sinus migraines, and I had a stomach bug. Anyway, so last week I went to the ENT doctor because I was having these migraines. So when you go to the ENT doctor, they will numb your nose, and then after, when it's actually numb, they have a huge scope, it goes in your nose to see how air and how much mucus you have or whatever. With your sinuses, you're supposed to have air in your cheeks and your nasals and above your eyebrow. With the CF, you have a lot of mucus in your sinuses, and you get infections and polyps, and so they give you, sometimes they'll give you antibiotics, and then you do surgery. I've had 5 sinus surgeries my whole life. Sorry, I had 4 sinus surgeries, not 5. So they do biopsies to see if you have like an infection or what kind of antibiotics and stuff. And sometimes they do it right here, and it's alright, but sometimes it actually goes in your nose and it looks like they're poking your brain, and it hurts sometimes, especially if they're doing the biopsy. But it is weird because you're like in Egyptian, like the old mummy stuff, trying to get the brain. So I had to do that, but he just did it in my nose, so it's okay. And I did a C-scan. Oh my god.
Stroke! Stop mocking me!
CT scan, and I go back Friday to find out my results and see if there's another relief thing for my migraines or another surgery. When I get these migraines, it starts to hurt in my right eyebrow, and then it starts to go into my nose, and my eyes start to hurt, and my upper face just hurts, and I have to take some pain meds and a lot of light and sound. It's even worse. So most of the time I'm laying down the whole day because it just hurts. If you're going to the ENT doctor your first time, you'll probably get the little numb medicines, and then they'll have the big scope in your nose, and most of the time they'll do like a CT scan and stuff like that. And if you have a CF, I'm sure you just get a biopsy. It's just so we'll probably, I don't know if we're gonna do a video in the ENT doctor, but we'll probably do after to see if I'm doing a surgery or not. So if you have any comments or questions, you just do a little comment and I will reply. Try to be quick, I guess. Yeah. Alright, my fingers are crossed to see if I can find any relief from my migraines or sinus surgery. Alright. See ya!